Welcome everyone. As you know, we have launched a complete pharmacology course for just rupees 399. This course is designed to help you master pharmacology for various pharmacy competitive examinations. As a part of this, we are offering a few free demo classes so you can experience our structured teaching before enrolling. Now let's get started with general pharmacology, the foundation of the subject. Before diving into specific drug classes and mechanisms, it's important to understand the basics, key terminology, and fundamental concepts that will help you build a strong understanding of pharmacology. Pharmacology is not just about memorization, it's about knowing how drugs work, where they act, and why they are used. This knowledge will make answering exam questions easier and help you think logically. So let's begin. To start with, what is the definition of pharmacology? As you all know, it is the study of effect of drugs on living systems. So we have to study all the way the effects of drugs on living systems. Living system means human beings in our case. So if you look at the definition, you can see a key term, drug. So the question is, why should we use drugs? Or when should we use drugs? The answer is very simple. In unhealthy condition. So whenever a person is said to be unhealthy, then a physician will prescribe a medication or drug. So if you are healthy, we will not use drugs, right? So there is an interlink between the condition called healthy, unhealthy, and drug and medicine. So I'll ask you one question. Can you define healthy condition or can you define unhealthy condition? So if someone asks how can you define healthy or unhealthy, the answer is, you can say with a key terminology, homeostasis. So this is very important terminology, homeostasis. So with the help of homeostasis, we can define healthy, unhealthy, and we can interlink the concept to the drug. So what is homeostasis? Very simple. Homeostasis is a well-being condition or well-balanced condition. So well-being or well-balanced condition is called homeostasis. So in order to understand this concept, I will take a very basic example, that is blood pressure. So what is a basic normal healthy blood pressure? That is 120/80 systolic versus diastolic. So whenever your cardiovascular system said to be in homeostasis, said to be in well-being, well-balanced condition, so your blood pressure is going to be optimum. So your systolic will be 120 and diastolic will be 80. So if something goes wrong with the cardiovascular system, I mean to say the well-balanced condition is disturbed. Okay, so in that case, the blood pressure may raise from the above blood pressure level or it may go down from the normal blood pressure level. So that is, we call it as hypertension, or if it is goes down, we call it as hypotension. So this is not said to be a well-balanced condition. So what we will do? So we prescribe antihypertensive drugs in terms of hypertension. So let's say for example atenolol, propranolol. So these are drugs. So what these drugs will do? So very simple. You pick any drug from the pharmacology. We have thousands of drugs, right? So you pick any of the drug, and if someone asks what is the basic role of any drug, common role of any drug, so the answer is, so all the drugs will correct the homeostasis, or all the drugs will set right the disturbed homeostasis. In terms of blood pressure, the elevated blood pressure will be normalized by a drug. So this way we can define homeostasis. So in this way, cardiovascular system, central nervous system, your GIT, your kidney, so every organ, every system will be in homeostasis. And if something goes wrong with that homeostasis, and you will see an unhealthy situation, and where drugs comes into the picture, and the role of drug, I said, to set right the homeostasis. This is very simple fundamental overview of the pharmacology with a very simple definition. So here we have discussed what is healthy, what is unhealthy, what is drug, what is homeostasis, and in what way drugs act and set right the situation. So next, moving on to the next topics, I will ask two questions. Why should drugs act? This is the first question everyone should ask themselves. And if so, where do drugs act? So you must know answer for these two questions. So this is very, very important to be discussed to get more clarity. So why should drugs act? Okay, so you have taken atenolol or you have taken a paracetamol. So why should that medicine or drug should act? What is the reason behind? Is there any rule that the drug should act? So drugs are being chemicals. Basically all the drugs are medicines or basically chemicals. So this is what the answer for why should drugs act. So in order to get the complete answer, we have to go to the next question and find the answer. Then we can interlink these two questions. So the next question, okay, we said drugs are chemicals, and because they are chemicals, they are acting on the physiological system. The next question, where do drugs act? So let's say in atenolol case, atenolol is an antihypertensive agent. So the answer will be atenolol will act on cardiovascular system. Okay, furosemide will act on kidneys. So in this way you will say specific drugs will act on specific organs. But if you simplify all these systems, organs, tissues, and you fragment it to the smallest structural and functional unit, the answer will be cell. So I would say all the drugs, okay, they act on cell. So here you have to know more about cell. What is a cell? It's a smallest structural functional unit, and a cell is said to be world of chemical reactions. Now what it means? So inside the cell, inside every cell, we have around 200 different types of cells. Can you give some examples from your end? Let's say nephron is a cell, neuron is a cell, your GIT is made up of parietal cells, your liver is made up of liver Kupffer cells, and RBC, red blood cell, white blood cell. So in this way we have 200 different types of cells. So our body is composed of around 200 different types of cells, and each and every cell is contributing for its own activity, and all together it is contributing a well-being condition called homeostasis. Altogether the discussion will goes to the homeostasis. So why a cell is said to be world of chemical reaction? Because inside the cell we have so many cell components. All the cell components, ribosomes, mitochondria, cytosol, DNA, Golgi. So all these cell components, and inside the cell we have cytosol, and there are a lot of chemicals inside the cell. Let's say water, oxygen, and amino acids and other different chemical components will present inside the cell, and with the help of enzymes are said to be catalysts, right? So with the help of catalysts or enzymes, they come together and the reaction goes on. So every second inside the cell there are thousands of biochemical reactions goes on, and because of the result of thousands of biochemical reactions, we are getting this final state called homeostasis. And these biochemical reactions goes in a structured way, in a pattern, otherwise the balance will be disturbed, otherwise you will be unhealthy. So if it is in the balanced condition, it will be healthy. So someone will take care of that balancing condition, that is CNS or brain, we can say. So the cell is said to be world of chemical reactions, and inside the cell there are a lot of chemicals. And coming to this question, the drugs are, I said, they are basically chemicals. So there is no surprising thing here that this chemical substance will come and react with this chemical substance present inside the cell. So obviously you can expect a chemical reaction between two chemicals, right? So in that way the drugs will go and interact with the chemistry environment of the cell, and that way they influence the physiological system, and as a result, as an end product, you will get a pharmacological response or biological response or therapeutic response. So this way the drugs will interact with the cell and they produce final pharmacological reaction. Next, if at all the cell and drugs is an important key terms, you have to study more about cell before you study more about drugs. So obviously everyone will study about drugs more thoroughly, but what I suggest, you have to understand what is a cell, what is the structure of the cell, and what are the components of the cells. Next, you have to interlink this with the drugs. I'll ask you another simple question. Okay, so do you have any idea of drug targets? So you might have heard about drug targets. Let's say atenolol, propranolol, metoprolol. So these drugs, if I am going to administer, so where these atenolol will go and binds with and produces pharmacological action. As most of you have completed your pharmacy graduation, right? So you might be knowing the mechanism of actions. We will say like beta 1 blocker, right? So beta 1 blocker means, so the drug will go and binds with beta 1 receptor. Beta 1 is a receptor, right? So the question is, yes, it's a beta 1 receptor, but what is the location of beta 1 receptor? What is the location of the beta 1 receptor? The answer is yes, it is located on the cell membrane. It's a located on the cell membrane. So there is a strong connection between the structure of the cell and drugs. So whenever there is a topic called drug targets, okay, so we will see receptors. Sometimes the target will be ion channel, sometimes the target will be enzymes, sometimes the target will be carriers and transporters. Okay, all these are targets, and whenever we consume drugs, so the drugs will target any of this and they binds with it, they modify it, and you will get the pharmacological response, right? So the question is, where you will find receptors, where you will find ion channels, where you will find enzymes, where you will find carriers and transporters. So my question is, what is the location of receptor, location of ion channel, what is the location of enzymes, what is the location of carrier and a transport? The answer is cell. So answer is cell. So one should learn more in detail about cell components, and especially cell membrane, and then you have to search for what is the location of receptor, ion channel, enzymes and carriers. then you have to move on to the next steps. Let's say for example, if the receptor is located on cell membrane, okay, so what is the role of receptor? I mean, what is the importance of receptor? Let's say if I am going to remove the receptor concept, what happens? So what is receptor concept actually contributes to homeostasis? That is very, very important. And if at all there is a receptor concept, okay, how many different types of receptors we have? So you know that we have 4 different types of receptors: ligand gated ion channel receptors, G protein coupled receptors, enzyme linker receptors, nuclear receptors, right? So my question is, why we have only 4 types of receptors? Why not fifth one? And if so, only 4 types, on which basis these receptors are categorized? Let's say we have so many receptors in our body: GABA A receptor, GABA B receptor, dopamine D1, D2, D3, D4, D5 receptors, nicotinic, muscarinic, and under muscarinic we have M1, M2, M3, M4, M5, and we have another different types of receptors. So all these receptors are categorized into various classifications. So why 5-HT3 receptor, a ligand gated ion channel receptor? So you must know all these reasons from the fundamental root level. Then only you will understand the subject and you can answer any question irrespective with the what type of examination it is. And not only in examination, in your daily life, in your work life. Let's say if you work in hospital, if you work in pharmacies, or if you working as a academic professor and into the teaching field. So if you know all these reasons at the root level, so you will answer, or you will be more confident on the subject. So in this way we are going to learn each and every terminology along with the root cause, and we will cover all the fundamentals, basics from the zero. So in this way we will move on to the next topics. So after general pharmacology we will study ANS, followed by CVS, and next CNS, next endocrine system, and we'll end up our classes with the chemotherapy. So this is the way one should study pharmacology. So I hope you understand what I'm saying, and yeah, that's all for today, and I will see you in the next class, or I would say next free demo class on autonomous nervous system. So in what way we have to study autonomic nervous system, so that will be your next video. So if you are not at all subscribed yet, subscribe to the channel to get more updates, and if you like this, share among your friends. So I'll see you in the next video. Thank you.